So one of the things that I wanted to do to begin with was to talk with you about how is it that we even begin to conceptualize this issue of autism. You know, basically, when we begin to consider whether someone is experiencing developmental problems that we call a pervasive developmental disorder, of which autism is one of those categories, we really look at an individual's social interaction, we look at their communication skills, and we look at their, display or lack of display of restrictive, repetitive, and stereotypic patterns of behavior, thought, or interest. A lot of people wonder, how do we ascertain who has autism and who doesn't? There are 12 criteria that I'm going to speak to later that are specifically used by clinicians to determine whether someone is along the autistic spectrum. But it's vital to understand that autism is really not a question of those who have autism and those who don't. When I speak to the 12 criteria in a short while, you'll see that all of us fall somewhere along the continuum in all of these areas of concern as we begin to examine an individual's social, communicative, and adaptive behaviors. So the question that arises, particularly for those individuals who are mildly along the autistic spectrum, how do you discern what's autistic like as opposed to what's normal development for individuals who happen to be a bit quirky? Since we know there's such broad variability for how we all develop and even for our daily notions as to what constitutes normal behavior and normal understanding and relationship with others, how do we begin to draw a line that differentiates individuals who have significant disabilities that are not remediated without specific intervention procedures? One of the things we begin to do when we examine all behaviors is we look at the peculiarity of behaviors. We look at the frequency of behaviors. We look at the intensity, and then we also look at the duration of behaviors. Because a little later, as I speak about the criteria, all of us will recognize some of our own quirkiness as we look at those 12 areas, that I'll speak to in great length, okay? And so the question is autism really a different variable of how people develop based upon their brain, their genetics, their social experience, and down the line, I would ask all of you to consider whether or not we really need to think of it as a disorder as opposed to an alternative form of development. Even the way that we look at behavior is very culture-bound. What is appropriate in our particular society where we live is not necessarily appropriate behavior, even as you go to different parts of our country, let alone going to countries other than the United States. So it's vital to recognize how these criteria are interpreted is culture-bound. And that is an important key to understand, because I'm really asking you to consider that autism, besides being a unique and different way of being in the world, has individuals who go through the same developmental process as the rest of us, present with specific difficulties that impact their understanding and their construction and participation in social, meaningful environments. But I don't know that we really want to look at it as a form of pathology or really speak of it as a disorder, because it comes across to varying degrees as a form of disrespect and of both a cultural and judgmental perspective that doesn't allow us to appreciate and understand the fullness of all individuals. Okay, so what I wanted to do before I even begin to talk about the DSM-4 diagnostic criteria is talk about some specific areas where we know individuals with autism have difficulty. The first area that I want to talk with you about is something that we call joint attention. Understand, all of us are born as infants and come into the world with an intact, neurological system that operates within a wide range of variability as I described. Joint attention speaks to the issue that young infants early on begin to attend to what others are attending to. Within the first year of life, we find infants looking where adults are looking, paying attention to what others begin to pay attention to. And as the result of that, this joint attention, meaning focusing on what other people focus on, begins to lay the foundation for both language development, play development, and socially learned skills. So, through generating this joint attention or joint focus, you could see how infants in their first year of life begin to link the language of their caregivers with the behavior and action that they are observing for themselves. And in actuality, joint attention is really joint engagement. It involves acknowledging that you are in a world of others and that you wish to learn and attend to and be curious about what you see others attending to and being engaged in. So joint attention involves being able to follow someone's gaze. For young children, there's something called proto-declarative pointing, where they point where they want you to look, because not only do they participate in what you're focused upon, but they also begin to want to direct the focus of others. You know, it involves showing things of importance. One of the things that I look at when I'm diagnosing children is whether, when they're playing and they create something that's special to them, whether they want to share that with those around them, or whether they're content to have created something wondrous just for themselves and don't find it noteworthy to get others to join in with them. Okay? Showing something of importance is vital because you could see the foundation that lays for a shared sense of what's socially important. Okay? So joint attention is one of these building blocks that is fundamental for creating a shared social experience. Now, the next step that often emerges and that we focus on both in terms of intervention and diagnostic procedures is something that we call social referencing. And basically what social referencing is, once a child is beginning to look where others look, notice salient features of the environment that are important to others, kids begin to construe and impute meaning based upon how others react to what's going on around them. So if you have a young child in a room with a caregiver and all of a sudden there's a loud unexpected noise, because the child's experience may not make him or her ready to determine what that sound is, what does that child do? That child will look to familiar others, look at their emotional expression, and on the basis of their caregiver's response, determine whether that situation reflects a form of danger that requires, evasive action, or whether it's just a noise that needs to be forgotten and one can move on because it's not of great significance. So what social referencing does for children who are now looking and attending to what others are doing is it teaches them how emotions relate to both their behavior and to other behaviors, and it creates a joint sense of social emotional meaning and understanding, which is the foundational component of reciprocal interaction. One of the other things that is very frequent that we find for individuals with autism is they have difficulties in what we call mind blindness or theory of mind. What that basically means is, for people who have brains that are wired in what we call a typical manner, is that they are accustomed very early on, as the child goes through a separation process, toward the end of their first year of life, is that they understand that other people are not extensions of themselves. They have thoughts, feelings, intentions, and agendas of their own. And then, once somebody has that fundamental understanding, you can see how what naturally progresses is that individual begins to understand that being able to make predictions about other people's behavior, about their mood, about what they will offer or what they'll withhold, provides a sense of security that not only diminishes one's anxiety in interacting with others, but it provides a basis for learning how to get what you want in an instrumental and functional manner. So many individuals with autism have no idea about what others are thinking or doing, and their behavior occurs somewhat in a vacuum. So you can see, once again, going back cumulatively, if you are not attending to what other people are attending to, if you are not understanding the emotional import or the social meaning of what is going on around you, and you don't understand that other people respond sometimes the same as you or differently, and how they think and feel about interaction and going through the physical environment, you could see how a lack of theory of mind makes it very, very difficult to establish mutual or reciprocal interactions that take the other person into consideration. And so for this reason, very often mildly autistic children are thought to be very selfish, to be oppositional, to not have a conscience. Some of them at an early age are identified as really being withdrawn and aloof. but it's really a function of their neurology because their brains are not wired to begin to interpret this social information from day one, and as the result of that, they dance to the beat of their own drum.